was a thin person for about half of my life. Starting in my mid-20s, I started putting on, first it was 10 pounds a year, and then it was 20 pounds a year, and all of a sudden, I was 230 pounds. And I'm only 5'6". That's a lot of weight to carry.
I couldn't really walk more than a block at times. And I'd be like, like, oh my God. And it's embarrassing. It is embarrassing.
The diabetes, I started off on an oral med, then they added another one. The high blood pressure, I was on one med, then they added a second one. Got to the point where I knew I had to do something other than what I had been doing.
Weight loss surgery is not for somebody who, just feels like they gained a little bit of weight over the summer. This is really for people who've been struggling with their weight for a long time, who have tried other methods in the past.
With weight loss surgery, which is an approach where you're combining both diet, exercise, lifestyle changes, and a surgical procedure, you get excellent long-standing results, and the patients really, you kind of change, they change their lives.
Buying clothes is pretty amazing. I went and really liked the people that I met here and felt like they were approaching this from a holistic model as opposed to just, we're gonna help you lose the weight.
It's not just talking to a surgeon. There's a nurse, there's nutritionists, there's a psychologist. You have to go through testing, the x-ray, the ultrasound. Everybody knew about the program and what you were going through, and they just made you feel very comfortable through the whole process.
It's not just about the procedure. It's about all the lifestyle changes that go along with it. It's all about the dietitian counseling. And we have a very robust program.
So this right
A big piece of this was learning how to eat properly. Somehow I never learned that.
They do everything with you, and that is so important. Before I actually had the surgery, doing everything they wanted us to do, I had lost almost 75 pounds prior to the surgery.
The doctors here are incredibly qualified. The reputation here is well-deserved.
I always want my patients to know what they're signing up for. And I want them to be the ones who make that decision. You want to make sure that they understand. So explaining what the options are, really going into the details of that.
Within 2 days of the surgery ending, I stopped having pain. I don't have any scars. I don't have any side effects.
I was in the PACU for a short amount of time. They got me up to the floor. Shortly after that, I was walking, doing laps around the floor. Post-surgery was a walk in the park. It really was.
2 days later, I was taking walks around my neighborhood with my wife. And 2 weeks later, I was doing my 10,000 steps a day. And within 3 months, I had signed up for CrossFit.
I feel like I did when I was 17 years old. I went to France back in June with my daughter. And in 6 days, we walked over 20 miles. That never, ever would have been possible a year ago.
Most patients don't remember how they used to be before. And then they pull up some pictures and they come back and they tell me, oh my God, do you remember this?
We had planned to go to Ireland for a couple of years and not having to worry, oh, I might not be able to do that because I won't be able to catch my breath, and just, I'm happier.
The most satisfaction is when I see people back at their 6-month, 1 year, 5-year appointments coming in just for a hello, and they tell me about all the great things that they're doing now with their lives.
Last week, I went on a surfing vacation with my family, and for 4 days, I was surfing in the ocean with my sons, and I felt like a normal human being.